I'm Dr. Michael Nielsen. When I prescribe testosterone to men, they usually inject it about once a week. Now, everybody's different, and a lot of people ask, how frequently should I inject testosterone? My buddy does it twice a week. I'm doing it once a week, what have you. And there's not one size fits all, obviously. But I like to think of it this way. If I told you that you could go to the gym one time per week for 1 hour and get the same results as going 3 times a week for 20 minutes, most people would agree that they'd rather just go to the gym once a week, get it out of the way, and not have to worry about it just once a week. However, if I told you going to the gym that one time is then going to leave you sore and uncomfortable for the next 2 or 3 days, then you may say, well, I'd rather split it up and do it 3 times and not have to deal with that soreness, that discomfort. And similarly, men have different responses to hormones, and injecting once a week might not be the best thing for you, because some men, after they inject the testosterone, you do get a surge of it, and it can lead to other things, conversions to other hormones, something called DHT, or rise in your estrogen levels. And that can cause side effects. Some men who are sensitive to these side effects, things like acne or mood swings or irritability, those can all be mitigated or lessened sometimes by just increasing the frequency of the injections. So you do it Monday and Thursday instead of just every Monday. The point is, every patient is different. We all respond to hormones differently. There's no substitute for working with a physician who has experience in this, who knows to look out for these things. But there's also no one size for everyone. And so when patients ask, how often should I inject testosterone? I can tell you most of my patients do inject once a week, because there's no substitute for compliance. And a medication will not work if you're not using it. And so I try and find the path of least resistance and try and find a regimen that a patient can be compliant with and stick with, because this is a lifelong management. And for most patients, that once a week has the minimal side effects and has the most compliance.